Hello and welcome to YouTube channel HealthQ, the place where our mission is to not only motivate you but help you to move on to the brighter side of the health. How are you guys? Thank you so much for so much of support, so much of love, so much of consideration, and so much of encouragement that you have shown for our channel. So today is Friday, and we are back with another live session with one another expert, but this expert is so unique, so special because it's so rare to find good yoga therapist anywhere in the globe, and genuine yoga therapists who are constantly upgrading knowledge, constantly working on improvising their understanding of yoga as in science, because it's a deep space. People believe that yoga is just a regular thing and conventional thing anybody learn these days and just start doing it. No, it's not like that. It has a very deep scientific approach to it. And to give you an understanding of what exactly is yoga therapy and how yoga therapy is different from other therapies or is conventional yoga in general, we have with us our expert yoga therapist at HealthQrehab panel, Ms Priya Nair. Hi Priya, how are you?
Hi, Namaste Regna, as we say in yoga. Doing very well. Thank you for having me here. Uh, and I'm looking forward to this session.
Even me too. Like this was one of the most awaited YouTube live that we had. We were planning to do this because there are a lot of people who we think that they need yoga therapeutic help, but just because of lack of awareness, lack of understanding, they don't show interest sometimes, or they drop off. So I think with the help of these kind of sessions, this kind of awareness activities, we will help them understand what exactly a yoga therapy is, right? So let's start with our first question that I normally have for all our guests in this you can say live stream, is how come you landed up into this space of yoga therapy? What is that journey? How you explored this place completely?
Okay. First of all, to answer that question, I'll introduce myself. I'm Priya Nair. I'm an engineer originally, software engineer. I'm based out of Bangalore. And, did the usual corporate job, moved to Bangalore from the US, had my second kid, took a short break, and then that break extended for a while. And meanwhile, I was always a yoga practitioner. I used to go to the gym, I used to run, and yoga was part of my workout routine. Okay, asanas, because that's how we know yoga is a fitness activity. So I wanted to stretch. So yoga was part of my, and like most people, it was lower down on my priority list. Okay, boring hai, couldn't hold poses for long, mind would start going here and there. So I was like any other person, yoga was just a part of my routine. Then, around 4, 5 years back, I decided to delve a little deeper because I really started enjoying sessions. Things happened in the family, and I found that when I do yoga, it really, used to help to calm me down, and it was something much more beneficial than all the other forms of exercise that I was doing. So I got into a yoga teachers training course, and it is so the basic course that you need is a 200-hour program, and it's unlike what I thought. It was asana was only a small part of yoga. It's an eight, yoga is called Ashtanga, 8 limbs of yoga. And asana is only one part. There was a lot of philosophy, a lot of breathing, meditation. And that's when I realized that there's a whole, it's such a deep science, years and years of studying. You cannot reach the depth of it. And that was the starting of my yoga journey. And I'm 44 now. And I also started seeing in Bangalore, especially, every person who comes to me has some problem, neck problem, back problem, some kind of posture related issue. If nothing else, some anxiety issue, something or the other, thyroid hair, BP hair. So I started thinking about therapeutic aspects of yoga. And that's how I got into yoga therapy. And currently, I am a ERYT 500 yoga teacher with a yoga therapist training, a 2 year program. You need 1,000 hours of training for that. We'll talk about it later. And now I'm dealing with people who have various conditions. And as we talk more about this, and we'll talk about the difference in yoga and yoga therapy, we will discuss in detail.
Absolutely, absolutely. So, Priya, my next question would be very obvious, like, what is yoga therapy and how it is different from a conventional yoga?
Okay. So, Meghna, in any form, yoga is very healing and therapeutic. Okay. So, what is yoga? Yoga is actually a state of mind. It's a state of equanimity. Okay. You are always you are in a sense of calm, and by using the tools of yoga, you're able to achieve that balance and harmony in your life, which promotes good health, physical health, mental health, emotional, spiritual. All yoga means complete. It's a holistic health. Now, yoga therapy is actually a part of yoga in which you're using these tools of yoga to specifically address a condition. Okay. So, when I say tools of yoga, it is asanas, pranayamas, chants, mantras, cleansing practices, meditations, self inquiry, discipline, lifestyle. All this comes under tools of yoga. So, in yoga therapy, you're using these tools to address a specific problem that you have or a specific condition that you have. Whereas yoga is overall health and well being. So, when you go to a yoga class, you're maintaining your good health or you're preventing something from happening. So, that is the goal. In yoga therapy, the goal is to address something that you're currently facing and you're working completely, all the tools are specific to that condition.
Mhm.
So, as an example, if you have a minor back pain or a knee pain, you will still go to a yoga class. Sometimes people tell me that, I did yoga and aggravate ho gaya, or which is a fact. It happens. People do get injured in yoga because sometimes you have already reached that point. It's not a small knee pain anymore, or it's not a regular back pain. It could be a slip disc, or it might be a bulge, or it might be something else, because of which you cannot do a regular class. You have to first go to a yoga therapist, fix that problem, or reach a stage where you're able to manage it, and then move on to a regular yoga session. So that is the main difference. The goal is different: general health and well-being, and catering to a specific condition.
Right. We lost you. Okay. Having said that, as you mentioned that you have to first go to a yoga therapist, fix the problem, and then come back again. So, how different from a training wise or else knowledge wise, what is the difference between a yoga therapist and a yoga instructor?
Okay. So, to become a yoga teacher, minimum you need 200 hours of training. Okay, this is not the college. There are colleges that have a BA in yoga and all that. I'm talking about somebody like me who's not into who has not studied yoga as a in college. But to become a basic yoga teacher, I need minimum 200 hours and I'll become an internationally certified yoga teacher. And they cover a lot of things. And so being a teacher also, you have a lot of knowledge. How to become a yoga therapist, because it's such a specialized. Not only I was a yoga teacher, so I had 200-hour experience. It's a 2-year program with 800 more hours of training. So you need 1,000 hours of studies to become a yoga therapist. And in that, you extensively study anatomy, you extensively study physiology, all the pathologies, psychology, philosophy. So you study all this in great detail. You study what is good for a condition, what is harmful for a condition, how to use the tools specifically, what to remove, what to add, how to counsel. Sometimes a lot of 30% is body only, and almost 60-70% is about the mind. So you also learn how to work with the client who comes to you. So you need a lot of training to become a yoga therapist, and that's why when you have a condition that is just not a small thing, it's something more. Then you need to go for yoga therapy rather than go for a yoga class.
Correct. And just to add on to that question, right? Since you are doing your PhD now in yoga therapy,
No, I'm
what
pursuing. I've just
pursuing?
started
Right.
my program.
Yes. So people do PhD in yoga therapy as well, right? So what depth, what kind of streams exist, or what kind of depth the people achieve when they go through this PhD process? Is it something like from a condition specific perspective, like how in medical science exists, like people take orthopedics or gynecology and stuff like that, or they focus more on certain forms like meditation or you said like Ashtanga yoga is a method. How does that work?
So actually, just to clarify, currently I'm doing a 2-year therapy program, after
Mhm.
which I will continue and pursue my PhD. So
Mhm.
I've, I'm going to pursue my PhD program, currently doing my yoga therapy 2-year
Right.
program. So once there are like any other PhD, specializations will be there that I yet have to decide what I want to do. You can decide to go into philosophy. So you can take one subject and go deep into the philosophy of of a condition. You can go into the anatomy of a condition. So that is, you take one topic and you delve very deep into that. So just like any other PhD, you have to decide what is your area of interest and go deep. I have not yet reached that stage. So currently, what I'm doing is I'm focusing on certain set of conditions. Like in my current program, I'm focusing on digestion.
Mhm.
So, all the digestive related problems. And my research is on that topic. It's a 2 month and program, and I have people signed up for that research topic. So in my PhD, I might extend it to digestion, or I might decide to go into something else.
Perfect. Perfect. All right. And how does this yoga therapy program work? What is the approach like for any condition, let's say?
So see, first of all, yoga therapy, when a client comes to you, they are not a passive recipient of the program. So it's not like I make a program for them and then they do it, and it's not like that. They have to have equal commitment. They have to invest that discipline. They have to commit the time, and like any other form of what to say treatment, they have to be consistent. I can give you something and you do with me for 2 days or 3 days, but the rest of the 5 days you're not invested in it, then you will not see results. So main thing is when a client comes into a yoga therapy program, they have to know that they are not only receiving, they are equal participants in the healing process. Okay. So first of all, an evaluation is done. We have a very detailed intake form where all the family history, eating habits, sleeping patterns, your work related habits, your activities, your exercise, your mental condition. Like it's a very, very detailed questionnaire. All that data is collected. We also have knowledge of Ayurveda covered in our syllabus. So some of us also analyze the dosha of the person, Vata, Pitta, Kapha, we analyze the dosha. With all that information, a holistic protocol is made for the client. Once that is done, it depends on the day. When the person comes to you, one day the symptoms are very high, they have a lot of pain, or they are very much in discomfort. That day, that class will be curated to try to alleviate that pain and relieve you of your discomfort. One day they come to you, they are very energetic. It might be a stronger practice that day. One day they come and it is, energy levels are very low, or mentally they're a little down. So we add a little more meditation, yoga nidras, relaxation techniques. So each day, because it's a one-on-one session, is highly curated for how you are feeling that day. And the final goal is, of course, helping you to treat you or to manage it completely. But each day will be different based on what experience you're having. So I'll
Right.
give you an example between a yoga and a yoga therapist therapy session. Suppose I'm a yoga teacher, somebody comes to me for a back pain. Okay, as a yoga teacher, I would do asanas to stretch, to strengthen the back. Okay, I'll do pranayam practices to relax. I'll also do some meditations because it helps them with generally feeling better. Now, as a yoga therapist, if the client is coming to me, like I said, I will do all this analysis. I find out in the meantime that apart from back pain, this person also has, say, COPD. They're having breathing difficulty. They have anxiety issues. So now I'm not only treating back pain, I have this whole picture. And I also know it might be because of maybe some stress in that person's life, some relationship problem, or maybe the demands of work are very high. So the cause, the lifestyle, the other supporting, like the other additional condition, all this is now factored into my therapy, not only back pain. So that's the difference. When you come for yoga, you're achieving something, but when you come for therapy, it is we are working on the entire, the holistic, the well-being of all levels, physical, mental, emotional, everything that is considered.
Understood. And so that takes me to the next question. How does a session is structured? How is this structured? How does it look like?
So see, each teacher has their approach. So like I said, the first session is usually an evaluation section, an assessment section. After that session is done, usually what I follow, I start with some sort of chanting and some sort of centering practice. And
Right.
then the typical thing is, do some sort of warm ups, do some sort of breathing. First, start getting the energy channels opened up. After that, you delve into certain practices, like if it is something for joint, then you start working on the protocol that you have made. So the class goes on like that, based on what, like I said, what condition you have, how you're feeling today. The class will go on like that. And usually ending, we'll give a good 12 to 15 minutes of pranayam, of meditation, of some mindfulness practice that is going to help you. So another very big thing in yoga therapy is, you work with acceptance, you work with acknowledgement of the problem that you have. Because
Mm.
first of all, whenever we have an issue, I do find, and even you must be finding, that people are coming for physiotherapy or yoga therapy when the condition is very aggravated.
Activated, right?
Whereas if you address the condition when it is happening, it is much easier to solve the problem,
Correct.
right? So main thing is there is no awareness.
Mm.
Let me first address it right now. We ignore it, we resist it. Then only when it is unbearable, we start to, work on it.
Mm.
So when you are doing yoga therapy, you start to develop this sense of awareness. You already
Mm.
start whenever an attack is going to happen or
Mm.
some trigger has happened, and you are starting to feel that this is going to go a little aage. You are going to start to
Mm.
train yourself to start to work on it so that it doesn't become a major.
Right,
So yoga
right.
therapy helps you with that as well, with acceptance, with acknowledgement that this is happening to me. Now let me take it in my own hands. Let it not, reach a point where it becomes out of control.
Mm. Correct, correct. Makes sense. And having said that, what are the conditions that you have seen, or according to you, yoga therapy can be beneficial or it can be benefited?
So yoga therapy actually, I don't know of any condition in which it will not help you. Okay, in any condition, definitely it will have some part to play. Now, depending on what the severity of the condition is, what the condition is, it might be treatable, or it might be just helping you to manage it somehow. And in some cases, it might not help to treat, but it will help. The breathing and the calming of the mind will definitely help you deal with the current situation. So, depending on the severity, you can manage, treat, or just help you support. But every condition, joint issues, arthritis, autoimmune, neurological issues, mental issues, any condition you name, yoga therapy will help in some form or the other.
Perfect, absolutely. And what is the role in chronic pain? Because since we are also dealing a lot with chronic pain, if you can put emphasis more on that and say how yoga therapy can be helpful or beneficial for someone in chronic pain.
So yoga therapy for all these issues like chronic pain is actually very, very useful. So I was reading a study by Stanford University. They have a department of pain medicine, Stanford
Mhm.
Pain Medicine Department, and I was reading a paper. And they had given 4 methods of pain management. Okay, they were talking about pain in great detail. And number one was medication. So you have your anti-inflammatories, you have your ibuprofens, number one. Second method to manage pain was intervention, where the pain medications are not working. You do an injection or you do a steroid or something like that. And these two methods, medication and interventions, are usually short term. They start losing efficacy over time. You need more medication, you need very often frequency increases. So not that great. The third one was physical therapy in that paper. Fourth one was your pain psychology. Now, when I read that paper, I found it very interesting that yoga therapy is actually, if you talk in terms of Western medicine, yoga therapy is actually a great combination of of physical therapy and pain psychology, right? Because with asanas, with pranayamas, and all that, you're also working on the body. But at the same time, with visualizations, with meditations, with learning to calm your nervous system, you're working on pain psychology. So it's a great combination. So, as an example, when you get pain, like I said, normal reaction to pain, when I have pain, first I will resist the pain, I'll bear it somehow. Then I'll start to ignore the pain. When the pain starts to become little higher, I start getting agitated and nervous. Okay, it starts bothering me. I feel that I don't have control over the pain. When you do that, you start triggering your sympathetic nervous system, right? You start getting stressed. The pain starts making you anxious. And
Right.
that further tenses your body and that further aggravates your pain.
Hmm.
So, in the sense you're suffering, you say, "Now I'm suffering from pain."
Correct.
When you do yoga therapy, all the practices that you're doing are to activate your parasympathetic nervous system, which is your rest and digest, your relaxation responses. So instead of resisting and ignoring your pain, you are learning to accept and acknowledge your pain. First of all, you learn to accept, "Ki, this is what has happened. Now, what am I going to do about it?"
Mm.
Once that is the first main step. Once you have accepted, acknowledge your pain, then you're no longer scared of the pain. You start, like I said, with
Right.
awareness. You start to know, okay, this is going to happen to me. Let me now start taking it in my hands and let me start working on it. With that, you're not triggering your sympathetic. So automatically the pain tolerance, the pain sensitivity, everything will start to reduce. So psychological level, this is happening with yoga therapy. On a physical level, as you know, you increase your mobility, your flexibility with various kind of stretching techniques. So all the stiffness in your joints, which is the one of the main reasons of pain, right? You're holding your body so tight, you're in pain all the time. You're learning to let go of that stiffness by
Right.
doing joint movements. Even in severe pain, very basic movements also can help you with pain.
Right.
Once you have reached a certain level where you're able to do some movements, you start working on strengthening, just like physiotherapy. In yoga therapy, we work with strengthening, we work with balance, coordination, with breath. Again, that is helping you to manage the pain. Breath is a great tool actually to help ease pain. You know, then uh, improve your posture with yoga therapy. Again, postural uh, indiscrepancies will also be a cause of pain because you're compensating. You have some problem somewhere, you're compensating by uh, tensing another muscle. So, yoga therapy will help you with your posture, which in turn helps you with managing pain. It helps you improve your metabolism, yoga and yoga therapy, which will help you manage your weight, which in many cases is adding to the pain. If you go to the doctor, they'll say, weight come karo, pain will reduce. So
Right.
that also is a part of pain management. Practices like yoga nidras are great for deep physical relaxation. Because even though we want people to relax, you know that always they're tense most of the time.
Right.
If you're learning to relax deeply with practices in yoga therapy, you're able to relax very deeply. Again, because of which you're going to let go of certain tightness and you're able to relax, and hence it will help you with pain management. It helps you improve your mood. Sometimes you're just crabby. Because of pain, you're crabby. But because you're crabby, you're in pain. So it's like, so on all levels, mental, physical, emotional, yoga tools are going to help you to manage it on all levels. You will be good to yourself, you'll be good to the family, you'll be good at your work just because your mood is great, you're feeling in control, you don't feel you're suffering. So it's psychological and physical.
Right. Awesome. This is so helpful. Let me now take some questions which we have received right now. So I'll just quickly read through. So Kavita is asking that I have been diagnosed with PCOS, plus have history of an injury to my knee joint, due to which I've gained a lot of weight. So what kind of yoga would be helpful for me?
See, for any hormonal related disease like PCOD, thyroid, diabetes, yoga is excellent. Lot of yoga practices that will help you balance your hormones. So even if you have a knee problem, there are a lot of practices that can be done seated, a lot of practices that can be done on a chair, using your breath. That is going to help you with your PCOD, PCOS. One thing, like you said, weight is a very important factor. Not only that, not only yoga practice, it's a holistic thing. You have to work on your diet to reduce the weight because you're unable to do a intense physical activity to lose weight. You have to use some form of dietary, way to lose weight, and it will happen hand in hand. So do your yoga, try to incorporate the poses. I think if I tell you it's not right because you'll not be able to do it. But there are great pranayams that work on your Vishuddhi chakra, work on certain chakras which are responsible for your PCOD. Twists are very good. Just to tell you certain things, twists are good. Dhanurasana is good for PCOD, PCOS. Forward bending postures are very good for any reproductive problems. So get in touch with a good yoga teacher and it will really help you. I have two patients, one with fibroid and one with PCOD, PCOS, who are with me right now. But I do see that they are able to manage their condition quite well.
Right. Let me take the next question because that's quite interesting one. So this person is asking that do we need to follow any particular diet when we are going through yoga? Like, are there any diet restrictions, or we can eat anything we want?
Uh, See, your body will tell you. If you have a good digestion, you have good bowel movements, it means your diet is okay. See, technically, if you're on the spiritual journey, uh, sattvic diet is the best. And ideally also local, seasonal, like what we know nowadays. That is the best diet. Eat everything, eat in moderation. If your body is not complaining, you can eat anything. Don't worry. Immediately, the minute you start eating badly, something or the other, sleep will be affected, motion will be affected, something will start happening here and there, gas will happen. So you will know. Just be aware of what your body is telling you.
Right, absolutely. Thank you so much, Priya, for all these insights. And I guess everyone who watched this live and will watch this live after this gets over, because it would be still live on our channel, would find it very helpful. Before we part away, just once, if you can just let everyone know how they can reach out to you if they need help from you, how they can just take that help from you.
Okay, thank you, Meghna, for having me here. And even I believe, like you said, that awareness of yoga therapy. If you just There are a lot of tools out there, physiotherapy, hai, yoga therapy, yoga, which all of us we have access to also. But with just the right information, we'll know where we should be going to.
Right.
So to get in touch with me, one is Meghna's platform, HealthQrehab. I'm there on Meghna's platform. I have my own website, www.anamayayoga.in. Anamaya means disease free. So that is my website. I have an Insta page with the same name. So if you need to get in touch with me, log into HealthQ Rehab or to anamayayoga.in.
Thank you.
And thank you
And
for
guys, you
having
can
me here
follow
once
her on
again.
Instagram. Yes, you can follow her on Instagram as well. She put amazing posts, a lot of insightful and knowledgeable posts regarding yoga. And if you have any questions for Priya, please feel free to put in the comment section, because the comment section will still be live after this live section gets over. The live section gets over. We will make sure that the comments are answered Alright. So the questions to Priya and your questions would be answered. Thank you, Priya. Thank you so much. I hope that you enjoyed this session. We thoroughly enjoyed it, and looking forward to have you more again.
Thank you, Meghna. I really enjoyed. And like you said, if anyone has any questions, I'll be there to answer them. And good weekend to all of you.
Sure. Thank you. All right. Bye bye, friends.
Bye.